Okay, we were speaking when we stopped for the break about the concept of cross-regulation between the different T helper subsets. Why I'm focusing on T helper? Because, as you know, in immunology, they are considered as the directors of the immunological orchestra in our body. So acting on them means that we are regulating the immune response. All the different TH subsets don't trust each other. So through some cytokines, they control, cross-regulate each other. And we just learned about interleukin 12, interferon gamma, and interleukin 4 has the basic cytokines for an aspecific regulation of the whole immune system. This is the table we refer to also in clinical management. This is the result of over 15 years of study. You can see that in this column we have the different interleukins. When we want to strengthen the activity of an interleukin, we use the same interleukin. It's very easy to understand. It's a positive feedback. When we want to slow down, downregulate the excess in activity of a cytokine, we use the antagonistic cytokine in order to recover the homeostasis. Now, we are going to really deeply study the inflammation process. And I will focus on these cytokines that are deeply involved in inflammation. They are, and we will study everyone, interleukin 1, interleukin 6, interleukin 8, and TNF-alpha. According to the concept of antagonistic cytokines, you see that for every interleukin involved in the inflammatory processes, we have an opposite down-regulating cytokine. Now we will study everyone. This is just to have a glance to how to apply the concept of antagonistic cytokines in inflammation. I have this question for you. What do they have in common? Look, heart attack, atherosclerosis, cancer, aging, metabolic syndrome, autism, gluten sensitivity, osteoporosis, Alzheimer's, and ... which is the common matrix of all these diseases. Inflammation. I mean, I'm not forcing the concept. In autism, we have an inflammatory process at the level of some specific brain area. And it's so important, the relationship between gut and brain in these children. They have a disruption, for instance, they have a disruption in the homeostasis of their microbiome with high level of Clostridium subtilis and Candida. They disrupt the homeostasis, provoke inflammation, and the gut, instead of to produce the right quantity of some mediators, produce less. The result is that don't produce these kids enough oxytocin, for instance, and you understand what it doesn't mean. It does mean. Okay, gluten sensitivity, osteoporosis, Alzheimer's. So it's important really to manage especially this. This is the cover of Time. 2004, I mean, it's not something we are telling now, the secret killer. The problem is that till now, for instance in Ireland maybe, we didn't have a solution for the low-grade chronic systemic inflammation because dramatically we use chronically, for instance, NSAIDs that have been developed for the treatment of acute inflammation. Instead, we use chronically this type of drugs with so severe side effects. Instead, it's much better to act on the immune system, recovering, once again, the homeostasis. Is it possible? So, the topic, is it possible to reduce the side effects of long-term anti-inflammatory treatments? Is it possible to fill the gaps of conventional pharmacology in the treatment of low-grade chronic inflammation? This is the bag of tools for a good biological management of acute and chronic inflammatory diseases. These are Guna anti-interleukin-1. We will see how and when to use every drug, especially Guna anti-interleukin-1 in acute inflammatory diseases. Guna interleukin-4, we will see, is applied in autoimmune origin inflammatory disease. Guna interleukin-10, that is the most important medication for chronic inflammatory disease. Guna TGF-beta, interesting because you remember is the cytokine able to downregulate both Th1 and Th2. Your question. Guna beta endorphin, it's an opioid, as you know, and it works very well in acute and chronic benign pain, for instance, in pain management. And the mother of all the anti-inflammatory drugs, that is Gunaflam. Gunaflam is a very interesting medication. It is a multi-component medication where you will find that the single cytokines that you can have as single medications are inside. I mean, with Gunaflam, you don't have to be worried if it's the right moment for an acute or chronic inflammatory disease. It is a wide range and spectrum medication. In fact, together with Guna Matrix, all over the world, it is the most used medication from low-dose pharmacology of Guna. So, now for 1 hour, I will stress you about this medication, how to use in the right way. Why I am so maniac about low-grade chronic inflammation, systemic. New England Journal of Medicine, 2011. This slide is very precious because let us understanding that even though we have a specific focus of inflammation in a specific tissue, always a single focus is trigger of systemic chronic inflammation. In this case, inflammation in a joint, rheumatoid arthritis, from the joint spread all over the body, the same inflammation through mediators of inflammation that you cannot read maybe, always more or less are interleukin-6 and TNF-alpha. So this joint is producing so much pro-inflammatory cytokines, interleukin-6, interleukin-1, TNF-alpha, but they don't affect only the joint, they affect the blood vessels, the brain, the bone, the muscle, the liver. It's absolutely mandatory to put down the overexpressions of these interleukins. Otherwise, you will have a systemic inflammatory disease. Okay? And there is a very interesting connection between the most important part of our triangle. Do you remember the triangle of the therapy? The blue part, drainage, more or less. The blue part, drainage. The yellow part, PN-EI rebalance. And there is a very tight connection between inflammation and drainage. Why? First of all, both these two mechanisms are involved in maintaining homeostasis. I mean, the best way to drain, detoxify our extracellular matrix is to be physiologically inflamed. A little inflamed, because we neutralize in the fire of inflammation the triggers, the toxins. The best way to prevent chronic inflammation is to remove the triggers of inflammation, the toxins. Another link between drainage and inflammation is that the extracellular matrix is the field of the battle of inflammation. Where do the inflammation processes happen? In the extracellular matrix. So if you clean the extracellular matrix, you are reducing the triggers of inflammation. This is a very nice slide for me. You can see a section of extracellular matrix, no? The interstitial space. If we don't have a good drainage of the extracellular matrix, the only possibility for the body to maintain the homeostasis in order to not to have toxins out of the extracellular matrix impregnating the cells is to burn the toxins. But the problem is that when you trigger the inflammatory process, you have also symptomatology. In this case, I try with this picture to show you that if you don't have a good drainage, if you don't have faucets working well, you start inflammation. We have a medications, and I want really to stress your attention on this medication, named Guna Matrix. It is really a basic, fundamental medication, because, in other words, it's able to open the faucet of detoxification and drainage. I will show you the composition. It's very complex. Excuse me, I want to see. Okay, perfect. And I want to spend 2 words on the extracellular matrix. Please focus on this tissue. I'm speaking about fibrillar, loose. Why? Because fundamental substance. Pericellular, connective tissue, the extracellular matrix. For us, it's absolutely important because it's the space between the external environment and the internal environment, the cells. All the substances, nutrients, for instance, vitamins, lipids, carbohydrates, proteins, are released in the extracellular matrix. But also signaling molecules are released here. Hormones, cytokines, neuropeptides, and they have to make a wonderful journey to link the transmembrane receptors. Which is the problem? Is that all the toxins go in deposition in the extracellular matrix, changing the condition of the extracellular matrix. If you look at the extracellular matrix of a kid, it will be smooth, transparent, very hydrated. If you look at our extracellular matrix, it will be brown, thick. Being thick, it doesn't allow the passage of the signaling molecules. This is one of the meaning of aging. If you clean the extracellular matrix, all the substances will pass through it to bind the transmembrane receptors. but just think in terms of oxygen. If you have a toxic extracellular matrix, oxygen doesn't arrive to the cell. The cell, in order to survive, so focus on the extracellular matrix, huh? In order to survive, differentiate itself in fibroblast, because in order to have an aerobic metabolism, to survive, shift in anaerobic metabolism. But to be in anaerobic metabolism, it becomes a fibroblast. If you maintain for 30 in culture, in vitro, for 30 days, fibroblast with 50% of oxygen, the following step of differentiation of a fibroblast, called a less vital cell, is cancer cell. In fact, in cancer cell, the metabolism is not aerobic, it's anaerobic. Is it important in terms of prevention of chronic degenerative disease to clean the matrix, that is, to open the faucet for the detoxification? Absolutely, yes. Using Guna matrix, that is the only medication able to work on the extracellular matrix, you will see a booster effect on every medication. I mean, if you are providing benzodiazepine to your patients, if you add benzodiazepines to Guna matrix, you will be able to reduce the administration of benzodiazepine, because more molecules of benzodiazepine will arrive to the transmembrane receptors. Guna matrix really can be a booster of every therapy. Absolutely interesting. This is the composition. Look how many ingredients inside of the product. Especially, I want to underline some of the ingredients. Interleukin 6. Be careful. I told you since 10 o'clock this morning, oh my God, that's the big bastard. You remember? It is the big bastard if it is overexpressed. I mean, in nature doesn't exist neither a good interleukin nor a bad interleukin. They are good if in physiological concentration. They are bad if overexpressed or downexpressed. In this case, interleukin 6 is 0.01 picogram per milliliter. And since that is the physiological concentration, one of the physiological action of interleukin 6 is to activate the metalloproteinases. Metalloproteinases are those enzymes like hyaluronidases. Hyaluronidases digest hyaluronic acid. Metalloproteinases digest mucopolysaccharides and proteoglycans that, as you know very well, in the extracellular matrix are part of the scaffold of the extracellular matrix. So, if you digest these proteins, you induce the solubilization of the fundamental substance of the extracellular matrix. You recover the capability of the extracellular matrix to have a Sol condition. In Sol condition, toxins are more able to go towards the lymphatic vessel for the excretions of the toxins. Interleukin 6 stimulate metalloproteinases. Interesting is the presence of tyrosine, phenylalanine, and histidine that are precursors of thyroid hormones. This medication, Guna matrix, give tone to the patient. It contains also dehydroepiandrosterone in physiological concentration, precursor of all the steroid hormones. In fact, especially in men, your patient will refer a side effect that is an increase in libido. So, that is not so bad as a side effect. But, yes, because much more tone, thyroid. look, hyaluronidase. The target is to induce the prevalence of salt condition instead of gel condition. Salt condition, youth. Gel condition, elderly age. Yeah.
Is there a test that somebody can do to check the condition of the extracellular matrix?
No, it's only clinical. Unless now we are performing a study on mice about the effect on Guna matrix on the extracellular matrix with some picture with electronic microscope, but there is no test. But we know clinically that it happens, obviously. Look also this remedy, I just highlight some of them. Tuya occidentalis. Tuya is a plant very well known in homeopathy because it is the remedy of the so-called condition named psychosis, not psychosis in the mind, psychosis. That is the attitude of some patient to store toxin. And it is also a very important remedy in homeopathy against water retention. In fact, Guna matrix is very used in aesthetic medicine against cellulite. Okay, from one side because it contains the precursors of thyroid hormone, and it contains also this plant named Fucus vesiculosus that increase the production of T4 hormone. So you increase the phosphorylative processes at the level of the fat cells with hydrolyzation of triglycerides in glycerol and fat acids. I mean, you induce the lipokinesis of the fat cell. Interesting drug. So you have to imagine that using Guna matrix, you unload the overload of toxins from the extracellular matrix, especially from the fundamental substance, to lymphatic vessel. Okay? Lymphatic vessel, all of them thoracic duct. Thoracic duct, left subclavian vein, and the toxins that before were in the matrix, then in the lymphatic capillaries, then in the blood, through the blood arrive to the organ of excretions. And this Guna matrix, for some of the ingredients it has, stimulate the excretion through the kidneys. Many patients will say, since I'm using Guna matrix, I'm urinating more. That's perfect. That's perfect because you are inducing the final excretion of the toxic overload in the most important tissue we have, that is the extracellular matrix. Actually, in 90% of the protocols, we always use Guna matrix because it increases the efficacy of every other medication. I think that this is the best anti-aging therapy. You can understand easily. If you have a toxic matrix, less beta estradiol, for instance, will arrive to the fat cell we have in the derma. Beta estradiol, this is just an example. Beta estradiol has a liposynthetic activity. So if you don't feed the fat cell, why? Because you are around 45, less estrogens, but also the level of intoxication is increasing. Fat cells are not more fit, and instead of to be hypertrophic, such as in a 12-year-old little girl, they are hypotrophic. Fat cells, together with collagen fiber, contribute to the formation of the bioscaffold of the derma. I mean, they maintain a good condition in the derma so that the superficial layer of the skin will not collapse on the derma. And when I speak in terms of collapse of superficial layer on the derma, I'm speaking about wrinkles. So, Guna matrix is important to preserve the integrity of the skin, but also of all the organs, absolutely yes. It's the most specific drug, but for me, maybe is the most important, because you are recovering years, going towards youth. I always, speaking about Guna matrix, just to laugh, I'm used to say, you cannot imagine how Monica Bellucci was before Guna matrix. She was beautiful, okay, anyway. But it's just the way to understand that if you clean the matrix, really, you allow all the signaling molecules, neuropeptides, cytokines, growth factors, hormones, to arrive to their target, that is the transmembrane receptors. So forget everything of this seminar, but please don't forget Guna matrix. And we use with the usual dosage, 20 drops twice a day, every day, along the specific therapy for the disease. Or when we use the total body detoxification therapy, 20 drops twice a day for 2-3 months. I use that because with my life it's important always to be first. I need an extracellular matrix clean, otherwise no dopamine arrive to my transmembrane receptors and I wouldn't be speaking this way. So to speak this way I need to be under Guna matrix, the dihydroepiandrosterone, thyroid hormones. It's really a great medication. I strongly recommend to you. Okay. And look our matrix, extracellular matrix. It's unbelievable because for 12 hours during